Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. National Association of Nigerian Nurses and Midwives declare 3-day warning strike. Taraba State government says students may be required to show vaccination proof before resuming. And India's COVID-19 cases see 5-fold increase in 1 week. Thank you for joining us. The Omicron variant of COVID-19 is killing people across the globe and should not be dismissed as mild. The World Health Organization chief Tedros Ghebreyesus said the record numbers of people catching the new variant, which is rapid outcompeting the previously dominant Delta variant in many countries, meant hospitals were being overwhelmed. He says while Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it does not mean it should be categorized as mild. But just like previous variants, Omicron is hospitalizing people and it is killing people. In the meantime, as the WHO records a jump in COVID cases and fall in deaths worldwide in 1 week, since the beginning of the new year, 35 people have died due to COVID-19 complications in Nigeria. Here's more on the pandemic update.
791 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 13 states and the FCT, indicating a drop from figures reported earlier. Lagos accounted for the highest number of cases with 523 infections. The FCT had 84. Oyo recorded 48 infections. Ondo and Kano registered 35 and 22 cases. Borno registered 16 cases, while Delta and Edo came in with 15 cases each. Ogun, Jigawa, Bauchi, Plateau, Rivers, and Bayelsa all had cases in single digits. The total confirmed cases in Nigeria now stands at 246,195. The report also includes a backlog of confirmed cases from Lagos and Borno states. No cases were reported from Ekiti and Osun states. 262 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 217,509. There were 8 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,066. Currently, there are over 25,000 active cases in Nigeria, while more than 3.8 million samples have been tested so far. With over 15,000 active infections, Lagos State accounts for the highest number of cases on admission, followed by the FCT and Delta State. Almost 10% of eligible Nigerians targeted for COVID-19 vaccinations have received their first dose, while 4.1% of the population have been fully vaccinated. The total global confirmed cases have surpassed 300 million, while deaths are beyond 5.4 million.
The Deputy Governor of Yobe State, Honorable Idi Bade, has received his booster jab of the AstraZeneca vaccine, in addition to the initial 2 jabs he had taken earlier in 2021 at the Government House, Damaturu. The vaccine was administered by his Chief Nursing Officer, Abubakar Janga. The head of service and some commissioners also received their booster dose. Speaking on the significance of the vaccine, the Deputy Governor urged the general public to visit the nearest health facility or any vaccination centers with their vaccination cards. According to him, the booster shot gives a better chance against the Omicron variant of COVID-19, soliciting the support of traditional and religious leaders to sensitize members of their community to the importance of vaccines. Well, for more on stemming the 4th wave of the pandemic, joining us right now is a public health physician, Dr. Ganyu. He joins us virtually. Thank you for joining us on the program. Now, the World Health Organization has said that the unavailable vaccine doses last year sort of created the perfect breeding ground for the emergence of virus variants. Sort of explain to us that science of the unvaccinated and the mutating virus.
Yeah, Yes, based on what the WHO Director General said is that it has been found that among those people that were not vaccinated, what made the virus to actually mutate is when there is ongoing transmission. So based on that fact, among those people that are not vaccinated, and which we have a very large proportion of them, there is that possibility that the virus will mutate. And that is why he was talking about the fact that we will not see the end of this pandemic in terms of the kind of variant that will still emerge. That Omicron is not the last time we make, or as long as there is ongoing transmission among citizens. And yeah, looking at the coverage, you'll find that not only Nigeria alone, it gave statistics that out of 194 member countries, only about 92 were able to meet the target of 10% in September last year and 40% as of December. It went as far as even saying that about 36% are yet to meet the 40%. And so, meaning that as long as there is ongoing transmission of this virus, especially among those people that are not been vaccinated, there is that possibility that the virus will mutate and a new variant may eventually emerge. And that was why he made mention of the fact that we are targeting 2020 this year, that by December this year, we should be able to achieve at least 70% coverage in all the 194 member countries. And that is why we may be talking about the issue of herd immunity, because without herd immunity, the transmission will go on. And unfortunately, those people that are not vaccinated, if you look at it very well, are those people that are relatively being affected in terms of severity and the rate of hospitalization. Thank you.
Dr. Ganyu, still, with all of this, I mean, yes, WHO DG has said that, but do you actually see the world sharing out vaccine doses, and this is more fairly to end the death and destruction of COVID-19?
Yes, certainly without that, because even made mention of the fact that no matter the period of giving booster doses for those that have had their complete vaccine, that may not actually solve the current challenge as regards to the ongoing transmission. So the way forward is to ensure vaccine equity, ensuring that every country have access to this vaccine, so that they can have appreciable number of people that are vaccinated. And if you look at it very well, the issue of vaccine inequity has been a major challenge. And one thing you have to understand is that we cannot solve the issue of this COVID-19 in isolation. Even if a country should achieve 70%, as long as people continue to move in and move out of that country, it may dilute such coverage, and which may also make people susceptible to getting infected. So the most important thing, based on what WHO says, that the country must move at the same pace and towards ensuring that everybody is covered and protected so as to prevent further transmission. As long as there is continued transmission of this virus, there is bound to be more mutations and likely of another variant, emerging in the nearest future.
So countries like Austria, for example, is limiting the validity of vaccine certificates to about 6 months, which would mean perhaps further boosters there. In Nigeria, hesitancy to vaccines is still rife. Some are even suggesting making it a prerequisite to getting a driver's license to present your vaccination certificate. What do you think?
Well, I think looking at the idea of issue of human behavior, because when you want to look at the issue of acceptance, uptake of vaccine, you have to consider many factors. The human factor. I would like to talk about that's what we call the dilution of innovation theory, which means that usually when there is a new thing, a new innovation, that usually the early adopters, those people, they don't need to be persuaded. You see them coming in, and we've been able to see much of that when the vaccine was first initially introduced into the country. Subsequently, we now have those people that have that hesitancy. They don't want to, they are still a bit reluctant, not being convinced and so on. So these are the people we need to talk to. Then we now have those people that completely resist it, they don't want. And what we have further complicated this has to do with the fact that the issue of misinformation. Maybe some people made some careless comments at the beginning that the vaccine can lead to important, can reduce life expectancy and so on. Then when I have disinformation, which is what the anti-vax are doing, a kind of creating a negative narrative as regards to that vaccine. So all these issues, coupled with the fact that we have some local factors, for instance, the issue of trust. I remember during the early stage when they were sharing palliative and so on, things were not done appropriately, and at the end of the day, you can see what led to that. People have lost trust. People are more concerned about the issue of accountability, a lot of misconceptions here and there. So in dealing with this, usually I said the aspect of presenting is one of the aspects actually to actually create demand. A kind of, you present your certificate first, which is part of an intervention and it was to address the issue of human behavior. Apart from presenting your certificate, you can also deny some people from accessing certain areas if you are not vaccinated, which is, all these are based on best practices. Maybe people going to the market, if you don't present your certificate, you cannot go into mass gathering where there are people, a lot of people will convert there. Apart from this, motivation can be that those are aspects of actually incentive for award, but we can go higher by kind of trying to introduce pluses. It could be a token, it may not be money, because I've said it earlier, in form of food or whatever, which we've done before when we are trying to kind of eradicate polio virus in the country. It can also help. Another point we can suggestion is we can have COVID-19 vaccine champions, ambassadors in our communities, and there will be like opinion leaders in the community, influencers. It could be partners. They will be trained on some of these basic aspects of what they need to do in their community, and through that process, they can also help in a kind of creating demand. Will be another aspect of what we are doing, risk communication, trying to enlighten people, let them see the importance of this vaccine in terms of efficacy, safety, and effectiveness.
Quite a number of factors.
So we need to actually put some of these things in place. Through that process, we can be able to develop some good strategies on how we can actually create demand, create uptake in terms of making people get
vaccinated.
Accepted to this vaccine.
Thank you so much. I also know that a number of people would prefer the incentive part, but we appreciate your time, your expertise on this issue. Dr. Ganyu is a public health physician. Many thanks for joining us.
Thank you very much. Thank you.
Well, still to come on the program, a report from Taraba State, plus new recommendations to curb the Omicron variant in Germany. We have that and more. Please stay with us. Welcome back. Secondary school students resuming for second term in Taraba State may have to present their test results for COVID-19 or their vaccination cards before they can be allowed to the school premises after the Yuletide holidays, pending resolution by stakeholders in the health sector. This was disclosed by the Executive Secretary, Primary Healthcare Development Agency, Jauro Hassan, while fielding questions on their level of preparedness to avoid community transmission. According to him, the National Primary Healthcare Development Agency has written through the National University Commission, NUC, directing state primary healthcare development agencies across the country to do same for tertiary institutions.
Those students that will be going back should at least have either a negative results for COVID tests or at least they should present their vaccination cards. Having said that, we have also received a mail from National Primary Care Development Agency through the National University Commission directing us to reach out to all universities across our states so that same will apply to them. And I want to assure you, we have already gone far. We have attached all those letters. We have written to University of Ukari, University of Taraba, College of Agric Jalingo, Kwararafa University, and also others. And we are also developing some mechanisms to reach out to even our polytechnics and monotechnics, College of Education and what have you, the leadership through the Ministry of Tertiary Education and indeed through the Ministry of Education in the case of secondary schools to ensure that we develop a strategy that would allow these students to benefit from this vaccination, which is free, and then to help protect them and protect other students that are also coming back to school after the Yuletide period.
And to Lagos, where a meeting organized by the state chapter of the National Association of Nigerian Nurses and Midwives to inform the government of an impending 3-day warning strike turned into a rowdy gathering when the Special Assistant on Labour to the Lagos State Governor, Babajide Sanwo-Olu, attempted to address the group. The members of the association were protesting poor welfare conditions and declared the warning strike will begin midnight, Monday, the 10th of January.
We are using this occasion to call on the government to help us attend to our agitations that we have put before them for quite some time now. The issue of acute shortage of personnel, they are trying to recruit, but it still needs urgent attention. And the way things are, is like there's need to declare a state of emergency in the health sector because so many things are calling for attention that the government needs to look into. The attrition rate is very high, the workload on our members is very high, and for our members to give the optimum care, there are some things that we expect the government to do.
Mr. Governor has given us the mandate to go and look at how to bridge the gap between the nurses' salary in the state and that of federal to encourage them to keep them at work. The work is ongoing already on their demands. Most of their demands, we have informed the leadership of the union at the last meeting we had with them that we are working on them. We asked them to come up with information that will assist the government in ensuring that most of their demands are met. So they are yet to come up with information requested by the government.
Away from Nigeria, Chancellor Olaf Scholz and state premiers are set to consider new measures, including stricter rules to enter restaurants. Shortening isolation periods has also been proposed. German Chancellor and leaders of the country's 16 states will discuss the COVID-19 situation in Germany during a video conference where German health minister has called for stricter measures. He said the restaurant business is a problem area, explaining in an interview that you often sit for hours without a mask, adding that better protection was needed against potential infection in such situations. Omicron is hitting Germany and now accounts for around 50% of coronavirus cases and rising. Well, joining us to talk more about this, Clifford Kunin, Deutsche Welle correspondent in Berlin. Hi, Clifford. What measures is the German government recommending to curb more cases, and what has been the immediate reaction?
Here in Germany, we're watching our neighbours somewhat anxiously as they're really feeling the impact of Omicron with hundreds of thousands of cases every day. And the government reckons it's only a matter of time before the prevalence of Omicron will really increase here. It's already trebled in about a week. So the focus now is on protecting critical infrastructure. And the government plans to shorten isolation periods for people like firefighters, nurses, power station workers and other frontline people who test positive for COVID. They want to cut it to 5 days from what's around 12 to 14 now. And they need to provide a PCR test or even a good quality antigen test. And also boosted people who've had contact with someone who's tested positive may also be exempted from quarantine after a week once they've no symptoms, although they will need to show a PCR test proving this. The other major aspect of the new measures is a very strong focus on those who've had their booster vaccines. From January 15th, only people with a booster vaccine could get into restaurants and cafes without showing a test. Otherwise, diners will have to show proof of 2 doses of vaccination or recovery from the virus, plus a negative antigen test. Other measures we're seeing here in Berlin, for example, the army has been put on standby to help with food provision and transportation should the system become overloaded by Omicron among health workers. What the government is not doing is introducing a vaccine register. Critics see this as an invasion of privacy. And also the debate about making vaccinations mandatory has gone quiet for now, with the focus instead on getting more vaccinations.
So essentially different stroke for different folks. But looking at Germany, Europe's biggest economy, what kind of impact could this have on people going to work, restaurants, gyms, for example?
Well, German employers are worried about a massive shortage of workers, basically. German industry is focusing, a bit like in the critical infrastructure, on keeping quarantine periods short. So supermarket shelves get stocked, banks can function, technicians and other essential services don't suffer. The government expects Omicron to hit the economy, but they think that it will only slow, not reverse the recovery. Inflation and rising prices are a fear, like everywhere else. And they're also fears about the virus causing unemployment for the first time in a long time. And as we've seen in New York, London and Madrid, rising case numbers mean empty cities. It seems unavoidable. Lots of people are being sent back into home office. The impact on the hospitality sector is expected to be tough. If we take a look at Spain, which is Europe's most vaccinated country, Madrid's restaurants are seeing half the number of diners compared to before the virus. And we can probably expect something similar like that in Berlin too. The government is looking rather anxiously at the schools as well. They're slowly returning after the holidays, but the numbers are expected to rise once they return.
Deutsche Welle correspondent Clifford Koenen joining us there from Berlin. Many thanks. And the Japanese government has declared a quasi-state of emergency in Okinawa, Yamaguchi and Hiroshima prefectures today in light of rising new infection case counts of the new coronavirus disease, COVID-19, in those areas. Here's more on the global COVID-19 update.
India's daily COVID-19 cases have jumped to 117,100, a five-fold increase in a week and on course to overtake its previous infection peak as the fast-spreading Omicron variant replaces Delta in cities.
This is a big concern, big challenge. We have seen that over the last 8 days, the figure has gone very high, from 10,000 cases to more than 1 lakh in just 8 days. So with this speed, the number is going to be much higher than in the previous waves.
Delhi, where daily cases have risen by more than 5 times in a week, goes into a 55-hour lockdown from Friday night to Monday morning. Authorities have also imposed a night curfew on weekdays, closed schools and ordered most shops to open only on alternate days when there is no curfew. The Japanese government has declared quasi-emergency measures in 3 regions that host U.S. military bases to stem a COVID-19 surge that some officials have said the bases have helped fuel. Prime Minister Fumio Kishida says the measures, which will allow steps such as limiting the operating hours of restaurants and bars, were needed to rein in surging cases. The infectious Omicron variants have been found in about 80% of Japanese prefectures. Officials say the Omicron outbreak in Australia's most populous state could peak by the end of January. As a result, New South Wales State Premier Dominic Perrottet has postponed non-urgent surgeries and reinstated a ban on singing and dancing in clubs and pubs, including in Sydney, the state capital, and home to more than 5 million people.
And on a programming note, Nigerians in diaspora have been speaking about the participation of vulnerable groups in politics as the country braces for the political horse trading that characterises an election year. One of them is the British Labour MP for Newcastle upon Tyne Central, Chi Omura. While commenting on the high cost of running for public office in Nigeria, she stressed that the only way for women to change the narrative is for them to actively take part in the political process. Well, you can watch that full interview with the Labour MP for Castle upon Tyne Central on our new programme, Diaspora Network, which captures the activities of Nigerians that are flying the country's flag outside the country. The programme makes its debut this Saturday, 7:30 p.m, with a repeat broadcast on Sunday at 11 p.m. And our website, channelstv.com, has more details and more stories, also a better understanding of the coronavirus pandemic. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.